Hi, I'm Dr. Edwards, and I want to talk to you about why I do integrative medicine as a part of my practice. You can really think of it as integrative and holistic medicine. Integrative medicine is a way of bringing the totality of what we know about the human body and the human psyche together in one package to treat people. One of the problems with Western medicine is that it really separates people into silos. Over here is your physical being silo. Over here is your mental and emotional being silo. Over here is your spiritual silo, and let's not talk about that at all. Really, that's not how people work. People are an integrated whole. Even in medicine, we learned about different systems like the renal system or the pulmonary system or the cardiovascular system. Like those were separate things, but they're not. They're integrated wholes, a part of how we are as a human being. And what I love about integrative medicine and holistic medicine is the idea that we're not going to look at people as just little separate disease processes, but rather we're going to look at the whole person. And we're going to treat the whole person. So integrative medicine, first of all, looks for root causes. So it's not just, hey, I'm going to go treat these symptoms over here, or I'm just going to go treat this disease, but rather what caused that disease? What caused those symptoms? Is this autoimmune disorder because of an environmental factor? Does it look like an autoimmune disorder, but it's really a vitamin or nutritional deficiency? Is my patient that's having chronic belly pain really just extremely depressed and we need to deal with that? And that's something that in medicine, we don't get a lot of acknowledgement of the fact that much of what we're seeing in our practices is not so much a physical condition, although I want to reiterate that it is physical, but it's the root cause of that problem is really emotional. We don't live in a normal society for what we evolved in. We evolved to live in very small tribal groups out on the savannah where we knew at most 50 people. Now we're in a world where what goes on in a country of 330 million people comes into our inboxes. We see it on video every day. That's a lot of emotional trauma. That's a lot of grief. That's a lot of negatives. So when you have all that coming in, your body doesn't know how to process that. We're not built for that. And so a lot of the depression and anxiety that we're seeing gets brought out in us in a way that other people and even we can understand, and that is through physical symptoms. Everybody understands that you have a bellyache. Everybody understands that you have a headache. That's a physical manifestation that's socially acceptable. To say, wow, I'm really down because it seems like the world is a very dangerous place, often gets perceived as weakness. And certainly admitting to any kind of psychiatric or mental issue seems weak to many people. The truth is, it's not just a psychiatric or mental issue. It's also a physical issue. And it's not just a physical issue. It's also a psychiatric and mental and spiritual issue. One of the things we're learning a lot about in addiction medicine is that addiction is really, as a root cause, is a lack of connection with other people. Well, think about what we do on a daily basis. How much of the simple human connection has been lost in our society, even before COVID-19? What about moving from an extended family into just a nuclear family? So instead of being surrounded by 18 or 20 people, you have maybe 2 or 3 other people to make connection with. People used to be part of churches more often, and so they had connections there. But that is really reduced. People used to sit on their front porch and watch people go by or talk to people as they went by. But now we all sit in our house and watch television or enjoy the internet. And don't get me wrong, I love television. I love the internet. I love the modern society. I like flush toilets. But the truth is that there's some costs, some psychic costs, some physical costs to our modern society. And that's really what integrative and holistic medicine tries to get at. I don't just take for granted that your house does not have mold in it. I just don't take for granted that that physical pain you're feeling is not a manifestation of something that happened to you 20 years ago and you haven't dealt with it. You haven't dealt with your childhood grief. You haven't dealt with the loss of a parent. You haven't dealt with the loss of a dear friend. And that those things are connected. And I've had the opportunity and the joy really in this integrative practice of being able to help patients through those kinds of things by being able to discuss them and really delve in to what's going on in their life, and also delve in on what's going on in their spiritual lives. So I get an opportunity to teach meditation. I get an opportunity to teach relaxation exercises. I can talk about religion with people, and it doesn't matter to me whether they're Buddhist or Christian or Muslim, or I've even had some patients who were Satanists. I've talked to them about it, and it's a great conversation because for their needs, they're getting them met in that place. Now, as a Christian, do I have some questions about what's going on? Sure. But as a physician, I can approach that as looking at their whole self and what attracted them to that thing. Or maybe I've had a few patients who've been in cults. Like, what attracted them to that? What was going on? What's going on in their psyche that they would feel the need or feel that their needs were met in that kind of environment? And integrative medicine allows me to address all of that. It allows me to look at all of that. And it's not easy. It's not something I could do in a 7.5 minute visit. That's why my visits are a half hour or an hour and a half for my first patient visit, because I need the time to do that. And integrative medicine allows me to do that. The other thing it lets me do is it lets me bring in other practitioners and really work as a team to take care of patients. I have a specific patient right now that is really working through a lot of issues, and she's got a physical therapist, she's got a mental health counselor, and she has me, and we're all working together to help her work through her injury and the emotional issues that brings up. I could not do that as an insurance-based, just regular doctor. I need to be able to have the freedom to take care of the whole person, and integrative medicine allows me to do that. If you have more questions about integrative medicine or how I practice it in my practice, please check out my website at please check out my website at wowhealingcare.com. You can also Google integrative medicine. There are integrative medicine foundations, and there's a great deal of information on the internet about it and about why physicians who practice it really enjoy it. Thank you for listening. This has been Dr. Edwards, and please, if you have any questions, email me.